I would call Rajat from eZaango Care Partners to take over the mic from me to go through with you on the good things that they're doing, and they're making things much more easier with the software system for the NDIS providers. Rajat.
So a little bit about myself. See, I'm Rajat. I had education done in India, around 25 years of software development experience I had, and for the last 4.5 years we stumbled upon this beautiful industry, aged care and NDIS, and we started working on that software, and then there is no looking back. Spent almost 2.5 years developing the software only, and then after that when money was running out, we started thinking of selling it out, and there was no looking back since then. And for the last 1.5 to 2 years, we have accumulated more than 150 clients at the moment, and still more and more people are joining. What we provide is we looked at all the pain points basically for the clients what they are facing. There were so many softwares available in the market, but every software, every client we spoke, they had pain points. They were using multiple softwares to manage the business. So we put together, everything in one software, and that's how we developed it, so that they don't have to, look at any other software and any other, like, to do your tasks. You don't need multiple softwares to manage it. Basically, that was the whole idea behind it. We knew that you have got X amount of money coming from NDIS, and then we know that from Fairworks Australia you have got X amount of money, but you definitely have to pay to the support staff. And there is only that gap money left with you. We are trying to optimize that gap money so that you can use more of it, and you can spend more time with the participants, cutting down your more and more of your admin time. That's what it is all about. That's why we say that a complex industry like yours deserves a simple solution. So it's much easier to use, much simpler to use, and once you look at the its look and feel, it's very simple, very easy. So I will move forward from here. That's what I think I spoke about. Now, we are a team of software developers. Currently, we have around 35 people on board, which comprise of business analysts, project coordinators, then operations manager, and then we have got like developers, around 15 developers on board. Then we got testers. We got onboard team of SEO and website development and all those things. Close to 35 people on board at the moment for us, and we are trying to provide that whatever your business needs, basically, that's where we come in. I think all of you have got brochure in your hands as well. First thing, on the first page it says that we provide the customized solution for you. Like, you ask for the thing and we will deliver it to you. We should have it already in the system. If it's not there, we can build it for you, and we can do it in no time, because every software, every enterprise customer, we are on one-on-one basis. It's not like any other competitor in the market. They got just one software. It is very difficult for them to do all the customizations for you, but for us it's very simple, very easy, because you are one-on-one basis. So we have one of the clients of ours, they are using the system. He's sitting in the middle. I will ask him a few questions as well soon. So he's using it for the last couple of years, and he has done lots and lots of customization of the software to suit his needs and requirements, and we have built it. So the whole idea of doing this is, like I have already spoken, that to reduce your human efforts, like admin time, we have to reduce it. That's what we do it. I think other points I have already spoken about it. Like, we have got uptime of 99.9% because the whole solution is based on Amazon, and which is in Sydney server, and that's where we operate from. And that's, I think, one thing. If you tell your auditors that your data and everything is on Amazon, they will not ask you any further questions. If it is not Amazon, they will give you 3-page document which you need to fill into, so that they can make sure that your data is secure. And if it is on a physical server, then even audit will be a bit more harder for you. So again, I have spoken about it. We are a team of professionals, and we have done it for the last. We are doing it like I'm running my company for the last 15 years in the name of Supersonic IT Solutions as well, where we are developing online softwares. But for the last 25 years, I'm developing online softwares. I call it, it's a dinosaur age. That's when I started. When at that time it was only HTML and JavaScripting or some active server pages, ASPs or GSPs were available only. And after that, all the softwares they have, all the things they came out, and we have gone through all of them. So goal is to minimize your complex administrative tasks, enabling more focus on care, providing with a software solution. For example, I can give you the example of one of my clients. They are running around 500 shifts a day. When they came to us, they were with 180 users on board. We saved them doing only the invoicing and payroll. We saved them 60 hours per week. They had 2 people doing only the invoicing and payroll, and they had 1 person who is doing the compliance. He was checking the compliance of every staff worker who is going out in the next 2 days. He used to check all the compliance documents are full. That person's job unfortunately became redundant, but that person was still on board with the company because our system looks after all the compliance automatically. You don't need to worry about it, and the system and you don't need to upload the documents as well. From the app, staff can upload all the documents on its own and comply. You have to just check it. Yes, it is done. If the compliance is not there, you will not be able to send the staff to shift. So that's the products we have currently: disability care and support coordination. Couple of them are missing from here. One is age care, and we also do software for companies who are providing the staffing as well. So we have staffing solution as well. So that's the you can see that that's the dashboard what we have shown over there. On the left hand side, the left-hand side graph is that tells you the daily transactions, and the right-hand side graph tells you, the left-hand side graph tells you the shifts, number of shifts you are doing on a daily basis, and on the right-hand side it shows the transactions. So it gives you clear indication if any day your shifts or your completed shifts or your transactions have gone down, why it has gone down. You can make it out directly from there. Support coordination, it has got quite a few options there. Even you can do budget tracking as well. You can write your notes, for invoicing. You don't have to worry about it. Like it's just a single click. You don't even have to click. Basically, as soon as you enter the time, how much time you have spent with the participant, it will create the invoice for you automatically. Allied Health, it has got, I think Michael sitting here, he has worked extensively with our team to develop this, allied health thing, and we have got quite a few options there for the allied health as well. So which can, reduce your workload, and that's how I think Michael can share his experience as well. Michael, do you want to say something?
Specifically right now, allied health.
Yeah, we have worked a lot.
I was put on the spot. I didn't even know Rajat was going to be here tonight when I signed up for it. Look, I think what he's talked about is the pain points for an NDIS provider across Canberra. The pain points for NDIS providers across, whether it's daily support provision, support coordination, or allied health, we experience them all, and actually having to try and come to a point of decision around software. I went through 12 or 13 different platforms. Was able to pick up the phone to Rajat, who did the demonstration, and then we've been able to build it out. So we've got a base set of software that we can continue to build out and expand and to, I suppose, to adapt to our business, because it's not about just you adapting to software, it's about software adapting to you, and that's what I have really experienced with eZaango. The other thing is I can pick up the phone to my support and they will answer, and I can have a conversation with them about things that are going on, if there are issues, and I'm very, very hard on them around I want it to be right, because if I leave behind the transaction or anything that we need to operate the business, then we've got to pick it up somewhere. So we should have probably about 4 admin staff. We've still got 1 who operates our rostering. So that's really good. So if I look at that real world, 4 admins to 1 pretty good, I think, for a piece of software. Allied Health couldn't find a solution for it that fitted in with what we needed to do. And again, building off the baseline of your platform, you know, it's getting better and better, and we keep developing it over time. It's one of those key pieces with the NDIS provision is to have a really good, transparent software that you can actually see through to the participant and to be able to see at any time what's going on, and that's what we've experienced with your software. So thank you.
Thank you. Thanks, Michael. Thank you. Thanks a lot, Michael. I think that's all the feature in this slideshow. We got participant management. You know, it has got every bit of information you can store at one place. They are planned documents, important documents. Even you can make those documents available on the shifts if you wish to. If you don't want to share, you can skip them. Plenty of forms, you can create your forms. It has got goal management, it has got incident management. You name the feature and we have it to, you know, store in the participant's profile. Funding management, even that's again kind of participant management. You can manage the funding. Even the recent reports, what we have generated is our system will tell you, like for example, you have got 200,000 funding for a participant and you are spending it week by week basis. Our system will keep on, you know, anticipating the funding for, you know, next week how much you can spend. If you have spent more, it will tell you you have to slow down. If you have spent less, so it will tell you you have to spend more so that you can be on track, you know, by the end of the plan. Then incident management, we don't have, you know, just the incident reporting. That's what most of the softwares have. That is the incident reporting. We got a complete incident management system where you can assign those incidents to your admin team, and from there, you know, they can put together their notes, findings, facts, figures, whatever, and then, you know, they can put together, you know, case study from there, and that case study can be shared from the same place. In the knowledge base, we got knowledge base in the system where, you know, it can go from there. You can put together a case study over there and then share it with the rest of the support staff so that that incident doesn't happen in the future. Client notes, that's, you know, every software has got it. Time and roster management, that's what me and Michael was discussing today, that he wanted to have AI built into this, and we are working on it already. And tomorrow I will be meeting him and having his ideas and views on that as well. But still we have got, you know, what we have is, that's one of the quite efficient and quite extensive, you know, the time and roster management system. So your staff, if they are late, our system will advise you, it will advise the staff as well that you are running late. If it still doesn't reach there, it will advise you as well that your staff didn't reach there. And they can clock in, clock out, they can put the notes. They cannot clock in from anywhere. They have to be at the place of work before they can clock in. Before that, they cannot even see, you know, the clock in button. Invoicing and payroll, that's what I told you. We saved, you know, one of our clients 60 hours per week. That was a big client. But how, in our system, how it works basically is once your support staff has completed a shift, it comes to you to approve in the timesheets. You just approve it. Then two things happen from there, that it goes into the payroll report and it goes into the transactions. From transactions, you select all the transactions and click send to 0 and it's done. So every transaction will be converted into invoice without having any faults in there. It will pick up the correct line item number, correct category, timing. Even if you want to send that information, who worked actually with that particular participant. If it is plan managed staff, invoice is created for plan manager. If it is self-managed, then it goes for the participant directly. And if it is NDIS managed, then, you know, it goes into the report where you can download the CSV. We are working on, you know, directly connected APIs are working. And if anyone, you know, wants to use that, they have to just get us the credentials from NDIS and we can connect it directly. We have started working on the gap invoices as well. For example, if any invoice is not paid, then by NDIS, you can download that CSV and upload into our system, and that will recreate the whole downloadable file for you. Goal management, you can attach the goals of the participant with the shifts as well if you wish to. And in the goal management, your staff, support staff, they have got access to the goal management on the mobile app, and they can write the progress there as well in the in the system, which will come to you. Lead management, that's one of the add-on. If you are having any leads, we can connect this with your website as well. Anyone filling up the forms there, that lead comes directly into the lead system. You can create your own nurturing system, and then you can drag and drop, you can make the notes, you can send them the service agreements from there. You can also send them the quotes as well from there. And once they sign the service agreement, it gets converted into participant automatically, because lead is a lead unless until they have signed the service agreement. Once it is signed, it becomes the participant. Then you can complete the documentation, the compliance and everything, plan documents and everything, and you can make that participant ready to have the services from you. Employee engagement, that is, we can keep the employee engaged with the chat, newsfeed, and knowledge base as well. If we have got HR component as well in the system, where we have got even bigger engagement part there. Compliance, I have already spoken about it, that your staff can actually upload the documents from their mobile app directly into the system. You have to just approve it after checking it, and if it is approved, they have got the dates, expiry dates, everything is on the system. They can continue to work until that date, and they get the reminder a month in advance, 15 days in advance, and a week in advance before the expiry of their current documents, so that they can upload the fresh ones. Data security, I think me and Michael had that small discussion just outside, that our servers are only accessible in Australia. So Michael was asking, what if I'm going to Fiji or US or So what you have to do is you have to give us your IP address. Our server is not accessible outside Australia at all, unless until you give us the IP address, whatever the country you are traveling. If you don't tell your partner where you're going, but you still need to tell us where are you going, where are you traveling, where are you staying. So we need the IP address of that place, so that we can open up that country and that IP address, so that you can access the. So Michael Bell is still thinking, what to do next. So server based in Sydney on AWS. Then we have got two-factor authentication as well, on the system. Data backups, it's happening every day. If any client asks us to do more data backups every 12 hours or 4 hours or 8 hours, we can do that. Data encryption, data traveling from your computer to our server, and data at rest. These are two things, that one, data in transition and data at rest. Everything is completely encrypted. If any hack attempts happen, they don't get anything, because the entire data is 256-bit security layer that is encrypted. Web browser security is there as well. That is everything, SSLs are in place and everything is there. Some common problems, I think I would say that the complex volume of paperwork, we are cutting down on that. You don't need to, like for example, I have seen the clients who come on board with us, they got the paper service agreements, which they sign it and scan it and then upload it. The whole thing is gone, because our portal has got service agreements built into the system under participant profile. You don't need any third-party software as well to sign the agreements. You can use our inbuilt functionality there, where all the service agreements, and you can you can put your own template in there, and within 2 minutes a service agreement is ready to be sent out to the client. If you are with the client, even you can take a signature there and then only. Then we have got staff schedule. We have got scheduling system. We spoke about that. That simplifies all the processes of your scheduling and all the rosters. You can even I'm not sure Michael has got that facility yet, but we have created the templates as well. You can create a template of this week or weekly or fortnightly template. You got it, Michael?
No.
Not yet. Okay. Yeah. Okay. So you can create, templates of the, your roster, and then you can go to the next week and paste it there, and all the shifts are created for you. Keeping in mind any staff, if that staff is not available next week, it will still create the roster, but that will be unassigned roster. So next thing is, providing the customized solution. It's not like we never say no to anything as long as it is within the NDIS guidelines. We get sometimes so many client requests which are, outside the NDIS compliance. we can say no for that, but other than that, anything and everything is possible on this software. You think of the way, like Michael said, it's not like the software, you have to worry about. It's the, your work you worry about that will make the software enough flexible, it will work with you. Then I think that's what we have already spoken about. We have got, few more things which are coming for the reporting. I told you a few reportings are already in place, and few more reporting are coming up. Like for example, you have got on your restrictive practices report that is coming up as well. Where if any of you are using any restrictive practices, there are 4 or 5 different types of restrictive practices, and you have to create a report out of it, and you will be able to do that. So quite a few reports are coming up. Another feature which is coming up, which I was talking to Michael, is that business analytics, which is it will give you quite a lot of graphs and things to analyze your business in which direction it is progressing. Then we have spoken about this as well already, that people they were using the extreme I have seen. I gave one demo to one of the client. That's the extreme I have seen. They were using 13 softwares to manage their business. Out of that, when they came on board, we killed around 12 of them. 13th was zero, which they had to maintain, and 14th was their telephone system. Apart from that, all the other 12, they were using Asana for something, they were using Monday as well, they were using one of the, one of our competitor software as well. 13 different softwares they were using. That's a lot, yeah. No. So we have, other option which only us, what we are offering to our clients. That is, branding of the software. The mobile apps, you can have your own mobile apps with your logos and with your downloadable with your logos from App Store and Play Store as well. Until a couple of months ago, we were only offering the enterprise level of our software. But recently we have launched our basic pro and premium version of the software as well, which has got different functionality depending upon at what level your business is. You can choose those things as well. So eZaango is growing. There are quite a few things which are coming. I think Michael will be quite happy. We are bringing in the medication management system as well in there. We did one survey, and with this system, once it is implemented, it is at the testing stage. Michael, you will get it soon. With this system, in place, it will reduce the medicine-related incidents, cut down the medicine-related incidents by 70 to 80%. That's how we have developed it. Invoicing for capital support, that was one of the requirements. When I met Bobby for the first day, I told him I have this software. That was a few years ago. He asked me one question: can your system, do invoicing for home renovations? I said, no, it's not there. It's coming up, Bobby will do. Governance, that's another thing which is coming up. Governance, documentation, and all that stuff. Then restrictive practices, I spoke about it. Now, interesting feature, Michael, AI. So that's what, we already have hired, one of the companies help. They are going deep into our software demo version, and they will be coming out to us in next couple of weeks or so with their ideas and how AI can help our software in which direction. But definitely AI is in a big hype at the moment. It is being used in generative AI, which is, you can create images, you can create the text, you go to ChatGPT. Probably most of you are using the ChatGPT these days. You write your command over there and it gives you everything in there. That is the generative AI. You can create images as well. Then there is conversational AI is there. That is quite, you might have used it. Conversational AI, that goes at multiple levels basically. What you are using is just maybe the text-based AI. But if you use Facebook's AI, if any one of you are using Facebook Marketplace, they got the most advanced level of conversational AI. It can do things for you. Like if you have listed any product, if it is not selling, it will come to you. Do you want to list it again, or you sold it? And if you say it is not sold, list it again, it will list for you again. You don't have to do anything, just keep the command. That is the most advanced level. Even Telstra has got quite good AI. But other than that, whatever you see on the websites and all that, that is very, very basic text-based API, AI, or maybe the database-based AI. So we are looking into that. Our AI is going to be quite advanced, and it will go with the machine learning as well, and it will be creating quite a lot of reports and doing the scheduling and rostering and other things as well for you. I think that's all about us.